First step in assessment of the eyes is to test for visual acuity. And one of the big mistakes that people often make in relation to testing visual acuity is to test for central visual acuity and leave out peripheral visual acuity. I suppose we shouldn't really talk about peripheral visual acuity, but the concept of peripheral vision and peripheral vision problems, while it's not often a problem in people in Janelle's age group, it's frequently a problem and one of the most common causes of blindness in people over the age of 45, 50. And we're talking here, of course, of the condition of glaucoma, which often leaves central visual acuity intact, but causes progressive loss of peripheral vision. So the first step is to ask Janelle to leave her glasses off and to use the Snellen eye chart for distance vision. Now, when we test central visual acuity, it's recommended that we test both distance visual acuity and also close visual acuity. So first of all, with Janelle's glasses off, we'll test one eye at a time, and Janelle, I'll ask you to cover one eye to begin with, your left eye to begin with, and read from the top of the Snellen eye chart, which is 6 metres from you, starting at the top and reading down.
HBLOVGNLBY TVDHC ZVBGLO. That's all I can see.
Okay, so Janelle managed to read down to the 6-9 level. Now, because the chart is 6 metres from Janelle's eyes, our numerator is 6 metres from the chart. Our denominator is, for her right eye, using the distance vision test, is 6/9. That means she can read at 6 metres what the average person should be able to read at 9 metres. Was that a surprise, Janelle, or you expected that without glasses?
Yeah, that's what I expected.
All right, we'll ask you to now cover the right eye and read with the left eye, using the same technique from the top of the chart.
HBLOVGNLBY TVDHC ZVBGLO EDLYTBH PVLBGTNO YCZETHDL GVUOLBNTD.
That's excellent. Thanks, Janelle. That means Janelle's eye is actually one line better, her left eye, than most people. 6/6 vision, or the old notation 20/20 vision, meant that people could read at 20 feet what most people could read at 20 feet. Janelle, at 6 metres, can read what most people would need to stand a metre closer, or 5 metres, in order to be able to read clearly. Now that's with Janelle's glasses off. We might ask her now just to check the overall prescription of her lenses, and now just check the right eye and just see how far you can go now with the glasses on. Starting at the top, Janelle, thanks.
HBLOVGNLBY TVDHC ZVBGLO EDLYTBH PVLBGTNO YCZETHDL GVUOLBNTD.
Very good. So her prescription is obviously quite accurate because she can read right down to the 6/5 line. One thing to note, and some optometrists in recent times have been doing, if Janelle faltered or made a mistake on that final line that she was able to read, we might call that 6/5 minus whatever letters she made mistakes on or faulted on. So her vision borderline could have been regarded as 6/5 minus 1 because of a slight faltering or perhaps even a mistake on that bottom line. So we're fairly happy with Janelle's distant vision. And for people Janelle's age group, perhaps that's as far as we need to go. It's very rare that a person who has normal distance vision would have problems with close vision. However, that's not the case for people over the age of 40. People over the age of 40 often have visual problems and find that they've got to hold reading matter further and further from them. This is not a disease. It's a condition called presbyopia, and it's a normal hardening of the lens of the eye. And for this reason, we really should ask people to use a pocket chart, such as the Rosenbaum Pocket Vision Tester. And we might just ask Janelle, just with her glasses on, with her right eye, and holding the vision chart about 14 inches from her, and just to go through the same process, just to read from the top as far as she can.
874, 2,843, 638, EW, EXOO, 8745, EMW, OXO, 10728, over 78.
Mm-hmm. That's good. Thanks, Janelle. You can see that the Rosenbaum Pocket Tester is quite good for someone like Janelle who might be on bed rest in a hospital, and we can't use the Snellen eye chart. But it's also very beneficial for someone in Janelle's, if Janelle was over the age of 40, to test her near vision. If she had this condition of presbyopia, we'd find in order to see clearly, she'd be holding the chart further and further from her. In recent years, optometrists have been using very specific testers that are a little bit different than the Rosenbaum test in that they're really a series of prints of various sizes that enable people to determine whether they can read newspaper print, or in some cases music script or cards, and a whole range of things including telephone books. And this is perhaps even more, if you like, in terms of reality of what people have to deal with in their everyday visual needs. And this is quite useful as well. So just in summary, we need to test distance vision using a Snellen eye chart and near vision using a pocket tester, or if that's unavailable, perhaps even a phone book or normal newsprint. We now go on to test for peripheral vision, which may be lost, as I mentioned earlier, as a result of conditions like glaucoma. The next step is to check peripheral vision. And while I mentioned in many cases this is not necessary for people Janelle's age, it's still a useful test in terms of when the patient has suffered some sort of a neurological problem. We need to sit facing the patient at a distance of about 60 centimetres or 2 feet. And Janelle, I'd ask that you look directly at my forehead, and what I'm going to do is get you first of all to cover your right eye, just with your hand, and I'm going to cover my left eye. And one of the important principles here, of course, is that the person doing the examination has got normal peripheral vision, because what we're really doing is comparing my peripheral vision with that of Janelle's. So what I'm going to ask you to do, Janelle, is tell me when you can first see the tip of my pen approach. Okay? So I'm going to start out here a distance equal between the two of us, and I want you to tell me now when you can see the tip of the pen. Now. Okay, again.
Now.
And again.
Now.
So what I'm testing is peripheral vision in each of
Now.
the directions, and again obliquely.
Now. Now.
Okay, and of course repeat the same process for the other side. So the same thing, Janelle, just keep looking at my forehead and just say now when you can see the tip of my pen.
Now. 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 Now.
And obliquely.
Now. Now.
Good. Okay, while you're there, in this position, I want you to look again directly at my forehead, and I want you to follow my pen, which again is about equal distance between the two of us, and I want you to follow just with your eyes, just keeping your head straight, and first of all just looking directly at my forehead and then at the pen, and just watch as we go over to the right. Just follow my pen. Okay, just follow the pen with your eyeballs. Okay, so over to the right and upwards and down and back to the midline. And what we're watching for are that Janelle's eyes move symmetrically. And of course we're looking for weakness in the extraocular muscles or a problem in relation to the cranial nerves that motivate these muscles, with the oculomotor nerve, abducens nerve, or the trochlear nerve. And we can see that there's no lag whatsoever. Janelle's eyes move symmetrically, both in alignment, and there's no problem whatsoever. So we've now tested extraocular movement of the eyes as well as her peripheral vision, and determined that her peripheral vision is the same as mine. So her peripheral vision has been superimposed on mine, and her extraocular muscles are moving in unison, and therefore her cranial nerves, oculomotor, abducens and trochlear, are all working appropriately.